All right, it is 9 a.m. I'm going to get started. Morning, everyone. It's an honor and privilege to welcome each of you to the 2024 Culture of Data Conference, brought to us all by the Colorado Public Health Association. My name is Dennis Wright, and I'm the director of this year's event, alongside my fellow epidemiologist, Taylor Bostick, whose work was instrumental in getting us all here today. So in front of everyone, I want to say thank you for everything. This conference has been made even better in no small part to your mind and work, and I could not be more grateful. Uh, whew, that felt good to say out loud. Let's see. In the same breath, I also want to extend my heartfelt appreciation to Rachel Massman and Ashley Cohn. They're skilled enough and brilliant enough to run this whole thing on their own if they chose, and provided us with the space and grace to grow into who we need to be for this conference. Vital does not begin to describe who they've been for us and continue to be even as we speak. So to both Rachel and to Ashley, it's an honor to work with you, and we're all better for knowing you. Thank you so much. Now, alongside the leadership team, we had a wonderfully supportive board of directors and an amazing set of volunteer committee members who gave their time and some skills to bring this all together. So our thanks go to the planning committee and our board as well. And of course, we want to extend our heartfelt thanks and appreciation to our sponsors who are keeping Culture of Data here for all of us to engage with. You'll hear from them as they get into the conference through today and tomorrow. Now, to everyone in attendance, from all of us here at Culture of Data, we thank you for helping us kick off what promises to be a truly inspiring set of discussions from all around Colorado. For the time being, attendees are all muted, but if you have questions during the Q&A section, please feel free to unmute them. You can also use the chat box if you have questions or need anything. And if you're comfortable doing so, please add your pronouns to your Zoom name by clicking the 3 dots on your video square and selecting Rename. This year's conference theme is Data for Social Good. Now, for those who were there, we mentioned this yesterday, we'll hear from some of the most brilliant minds and hopeful hearts in public health talk about using data to promote positive health outcomes, critical wins in disrupting social stigmas, and the power of uplifting community. We'll hear about promising new tools that make the invisible visible, that connect us from every corner of the state, and that take the fight against structural racism right to its front step. There will be plenty of inspiring and frankly heavy themes to get into, all in the spirit of bringing about health equity, whether we're talking about efforts specific to rural geographies, maternal and child health, or raising up self-identification as an experience to support rather than just a variable to control for. Now, if you haven't taken a look yet at the schedule, I highly encourage you to visit cphacultureofdata.com and sit with all the good we can celebrate in our work to support the health of those we love at home and those out there that we'll never meet. Our committee and leadership have put together what will be a galvanizing and impactful set of stories that will remind us all why we do what we do in our respective fields. Well, we all know how easy it is to become pessimistic and either grow enraged or numb to what's going on around us. And let's not kid ourselves. There is certainly a lot of work for us to do. It's equally important, in our humble view, to acknowledge that for everything that shocks and hits us over the head in the never-ending news cycle, that our work is not all for naught. Our speakers will remind you that those we care about are in good and capable hands just like yours. That is our hope as the conference moves forward, you'll feel inspired, replenished, and engaged, ready to tap into the programs, projects, and people that keep us on the right path, the path to health equity. And now, I'm asking everyone to please give a warm welcome to our esteemed CPHA President, Waveen Gongo. Madam President, we are ready for your address.
Thank you, Dennis. I truly appreciate that opening. Everything you said, I resonate with and am just looking forward to positive and successful conference virtual conference these next couple of days. Thank you for giving us something to reflect on as we get this started. And hello, everyone. It is my absolute pleasure to also welcome you to the Culture of Data 2024, representing CPHA as its board president. And I just want to, before we dive in, extend my heartfelt gratitude to each of you for gracing us with your presence today, virtually. For those of you who attended yesterday, thank you. CPHA appreciates your commitment to advancing public health and fostering positive change in our communities. And it's through gatherings, it's through these conferences, virtual, in person alike, that we can amplify our impact through meaningful exchange of information and knowledge, experiences and expertise and stories. And that's why we're gathered here, and we'll be gathering for the next 2 days. So thank you so much for sharing. Thank you so much for listening. We're very excited to get started. And I also wanted to express my excitement for the incredible lineup of events, of workshops and sessions that awaits you all throughout the conference. There will be thought-provoking discussions and sessions, as Dennis has mentioned, as well as walk and learn sessions scheduled for Friday. So please be sure to tune into those if you can. There's definitely something here for everyone eager to deepen their understanding and broaden their horizons in the realm of data and public health. I'd also like to shine a particular spotlight on the Emerging Leaders Showcase, which is also happening and is a platform dedicated to celebrating the wonderful contributions of emerging leaders in our field. And so please be sure to attend the showcase as well, if you're able. It is a testament to the vibrant talents and boundless potential within our public health community. And it'd be great that you could show our emerging leaders your support. And yeah, it'd be wonderful. And I'd also, lastly, would like to take a moment to recognize two remarkable individuals in this virtual room right now, who has been instrumental in bringing this year's Culture of Data together. That's Dennis Wright, who just spoke, and Taylor Balstick. As a director and associate director of Culture of Data, Dennis and Taylor have demonstrated an unwavering commitment to excellence and a relentless drive to ensure the success of this event. Together, they've poured their hearts and souls into orchestrating this event online, so we can all meet here today through challenging circumstances. And so it is thanks to their hard work and vision that we find ourselves gathered here this morning. So thank you, Dennis and Taylor. Thank you to our keynote speaker, who I will let introduce herself. And thank you all for being here. Thank you to the volunteers and to Rachel, and again, just everyone's participation behind the scenes here and moving forward to making Culture of Data 2024 as wonderful as it usually is. It's my favorite conference of CPHA, and so I'm really grateful that we get to gather and do this today. Let us undergo Culture of Data together this year. Let's unite in our shared commitment to creating healthier, more equitable communities. I look forward to being part of the conversations, moderating, and tech hosting. And thank you once again for being part of this conference. I will pass it back to Dennis.
Thank you so much again, Rubin. All right, just looking at time, I want to keep us moving. So grateful for you out there. Our keynote session has been generously supported by Colorado Equity Compass, and we thank them immensely for all of their contributions to the conference. So please, everyone, join me in welcoming Dr. Rochelle Espiritu, Laura Landry, and Rachel Boyer to say a few words.
Thank you, Dennis, and good morning, everyone. Welcome to the Culture of Data Conference. It is with great pleasure that the Colorado Equity Compass team joins the Colorado Public Health Association and you all today as we embark on a journey to explore the transformative power of data in shaping a better tomorrow. We're so excited to learn alongside you as we discuss how to ensure our data is working in service of equity. In other words, this conference theme, Data for Social Good. So again, my name is Rochelle Espiritu, and I'm a founding partner of Change Matrix. We're a small woman-owned, minority-owned business that seeks to motivate, manage, and measure change to support systems and communities that improve lives.
And I'm Laura Landry. I'm the Director of Evaluation and Learning at the Colorado Trust. a grant-making foundation here in Colorado focused on health equity.
Hi, everyone. My name is Rachel Boyer, and I'm a policy analyst at the Colorado Health Institute, which is a nonprofit consulting and research firm that's focused on improving the health of all Coloradans.
Thank you. So we're all partners in the Colorado Equity Collaborative, which includes our funding partner, the Colorado Trust, Change Matrix, Colorado Health Institute, and then our fourth partner who is not on today is Consume and Create.
Thanks. As we all know, data is an incredibly powerful tool that can drive change in our state, but its use can be problematic if community is not central to its collection and interpretation. This is why the Colorado Trust supports Colorado Equity Compass. In our work with communities, we heard a need for local level data, partners, and a platform that would be easily accessible. As a funder, we also wanted data sources to evaluate our work and to help decide where best to invest our funding. As a collective of nonprofit leaders, advocates, and parents, together we can navigate the way our data can be used to improve the conditions in which Coloradans live across our state. So how can we foster a data culture that empowers communities and inspires collective action towards positive change? This is where we hope you'll turn to the Colorado Equity Compass to support your work. The Equity Compass is a local, multifaceted platform that provides a wealth of information on what equity looks like in Colorado. We seek to equip change makers and decision makers with necessary data and stories to understand the specific barriers facing community members and to discover solutions that work for Coloradans.
Thanks, Laura. So I'll talk a little bit about some of the resources that you can find on the Colorado Equity Compass website. So one of our biggest tools is the Equity Data Navigator. The Navigator is a user-friendly database that we hope all of you can use to help find data about where you live and use that data ultimately to advocate for change. Using this Navigator, you can find data about the health status of your community and about key metrics about the social determinants of health, such as food, the environment, economic opportunity, and more. And with this Navigator, we ultimately strive to illuminate the disparities present in our communities through data storytelling. And by acknowledging these divides, we can better make community-informed decisions and ensure that everyone has access to the resources that they need to ultimately thrive. And in addition to the Navigator, the Equity Compass website also contains a story bank of stories from all over Colorado. Stories are such an important part of understanding a community and can provide really powerful information and insights. So we invite you to read the stories about the Colorado communities and also to submit your own to add to the story bank. And thinking about the Equity Data Navigator and the Story Bank combined, we can see that the Colorado Equity Compass really offers a unique opportunity to connect both the quantitative data with the stories to create really powerful data narratives.
Thanks, Rachel. And so it's our hope that you'll take this data and the stories that you learn about in different Colorado communities and use that to inspire action. So the space also offers an area where you can go to, where you can contact your representatives, for example, a school board member or your House representative, based on maybe findings that you see in your own community and action that you would like to take. On the platform, you'll also find a curated list of community-based organizations all around Colorado that have been tagged by various areas of focus, for example, focus on food systems or on housing, and also tagged by geography. So if you're searching around the Navigator and find something of interest and you want to reach out to somebody local or an organizational local there, you can do that as well. And then finally, we have a searchable resource library of tools, of data sources, of various reports, and also the stories that you can search based on category or type of resource, or if you're just beginning to start learning about data storytelling, you can do a search that way as well. So we hope that you'll be able to learn a bit more about different health equity issues and advocate for community change in your areas. I'll turn it back over to Rachel to talk about some exciting updates.
Yeah, so we recently actually enhanced and updated the platform to include refreshed, up-to-date data with over 96,000 data points. And all of these data are downloadable in really easy to use data sets. And all in all, we have about 69 key metrics related to health status and the social determinants of health, all with the goal of better reflecting the experiences of Coloradans. So I'll just briefly share a couple kind of headlines from our most recent data update. So on mental health, ever since the start of the pandemic, more people than ever have been reporting challenges with their mental health. And in Colorado, only 74% of people report good mental health, and this is a record low number. On economic opportunity, in 2002, a family of 4 would need to earn about $55,000 a year to be at an income that is twice that of the poverty level. In Mesa County, the median family income is about $83,000. And these are just a couple examples of information that are available on the Compass, and we invite you to explore the site on your own and find information about your area.
Thanks, Rachel. And I just want to reiterate that this data is not only available at the county level, but at the census tract level, which makes it very unique. We hear that people can get access to county level data, but it's like really digging down into neighborhood level data that makes the platform so much more powerful. So we do want to invite you all to a live webinar that will be on Thursday, May 2nd at 2 p.m. to learn more about the new features that Rachel highlighted, and also to get a demonstration on how to use the Equity Data Navigator to explore the health equity in your own communities. So if you can, feel free to scan this QR code that you see on your screen now to register. This information is also available on our website. So we do want to thank you all again, and thank again the Public Health Association for sharing, being here today and sharing in this meaningful event. We're so happy to be able to sponsor it. We hope that you're as energized as we are to get to work and to put what we learn here together into practice as we work with data for social good. So over the next couple of days, let's navigate by the compass, guided by all the different coordinates and commitment to social good. As we move forward, we encourage you to share with us, to keep in touch with us. Let us know how you're using data alongside community members to advance health equity. We know that every story counts, and we're so excited to provide a space for that for Colorado to help support communities to thrive. So thank you again, and enjoy the conference, and I'll turn it back over to Dennis.
Thank you so very much. And thanks once again to Colorado Equity Compass. It's now my honor to bring to you our keynote address. And it's doubly so this year because our keynote address will be delivered by not one, but 2 speakers. So please welcome speakers, Dr. Nicole Tuitt and Mr. Alexander Wyden. Will talk to us about the youth empowerment study they and others have been leading. Now, very briefly, Dr. Tuitt serves as the principal investigator for the study and is an assistant professor at the Colorado School of Public Health. Mr. Wyden is a high school junior, so take note, at STEM School in Highlands Ranch. The team will present for about 45 minutes, and then we'll have about 15 minutes for a Q&A after that. You'll hear from us once more before we break into our sessions, but at this time, we'll turn the platform over to our speakers, so please enjoy, stay engaged, and welcome Dr. Tuitt and Mr. Wyden as they present a youth-centered mixed methods approach to reduce structural racism and promote health equity for the youth of color in Denver Metro, Colorado.
Thank you so much, Janice, for that introduction. Can you all see my slides fine? Thumbs up?
We can.
Okay,
That's great.
perfect. So as Dennis said, my name is Nicole Tuitt, and I'm an assistant professor in the Department of Community and Behavioral Health. And I also conduct my research out of the Centers for American Indian and Alaska Native Health at the Colorado School of Public Health. So today, Sasha and I, Sasha goes by, his name is Alexander, but I call him Sasha, just as an FYI, so you all are not confused. But we are here to talk to you about our young people of color centered mixed methods study to identify the social and structural factors associated with substance misuse and sexual risk-taking among young people of color in the Denver metro area. So funder requires me to mention the disclosure. So this work was supported by the National Institute on Drug Abuse, the National Institute of Health under this award, and Sasha and I have no conflicts of interest to mention.
Hello, I'm Sasha Wyden. As mentioned, I'm a high school junior at STEM School Highlands Ranch, and I'm also an enrolled member of the Rosebud Sioux Tribe. Now, I'm a youth researcher with the Youth Empowerment Lab, and I work alongside my fellow youth researchers, Ariana Hall, Anaya Hill, Blessing Samuels, and Yuzira Martinez. And our team is pioneering a new model of youth-centered research that uses comprehensive youth engagement to understand and address the health inequities impacting urban young people of color.
So the theme of this year's Culture of Data conference, as you're aware, is data for social good. And so data tells stories about people, health, and context, and can be used to promote health equity and reduce health and social disparities among marginalized and minoritized populations. However, regardless of our intentions about how we use data, we're at risk of causing harm, misinterpreting or obscuring findings, and exacerbating the harms of colonial systems of oppression in which healthcare and public health are situated. So for data to be used for social good, it's important that we center the lived expertise of those we are trying to understand and those who may be impacted by the data or the research. So centering lived expertise allows for a deeper understanding of the persistent, pernicious, and complex social context in relations to power experienced by marginalized and minoritized communities that likely influence health. So here and throughout, we are going to use the term expertise and not experience, because expertise recognizes the values of what people have learned from their own experience and acknowledges that they are experts of their own lived experience.
Now, our intentions for today are to discuss the importance of centering lived expertise if our intentions are to use data for social good, and also to highlight the need for self-reflection and self-work from everybody involved in this process. And finally, to highlight how our approach to centering, our approach centers lived expertise by engaging youth of color throughout our study. Now, regarding the validity of centering youth engagement, really traditional notions of who is qualified to conduct science can be at odds with what is needed for the community. Many view research as a domain limited to those with traditional academic training, but this perspective falls apart when conducting research on populations whose views and perspectives may differ from those of the researcher. And this is especially true concerning projects investigating issues affecting youth. Now, youth, while traditionally only seen as research participants, can and should be fully involved within the research process. Now, if projects investigating topics relevant to the youth experience fully engage young people and allow them to take ownership of the issues that matter most to them, there are boundless possibilities for insight and change. Now, this idea of youth-engaged research has both pragmatic and ideological implications. Youth input could increase the relevancy and applicability of findings. Of course, us youth are the best experts on youth experience, and as such, we're able to identify crucial aspects or inconsistencies that adult researchers may miss, and we can shape a project in a way that reflects our lived experience. Youth input can also enhance the feasibility and ecological validity of a study. But also, as a matter of principle, youth have a right to be involved in research projects whose results directly affect their lives. Now, while patient-engaged research involving adults has seen increasing acceptance in public health, many remain apprehensive towards the idea of youth-engaged research, and this could be due to a variety of considerations. Some may feel that youth lack the expertise needed to meaningfully contribute, or that implementing pathways for youth engagement would require significant and infeasible alterations to experimental design. Now, it's true that youth researchers lack some of the advanced technical knowledge of their adult researcher counterparts, but this doesn't disqualify them from being able to contribute. Rather, we can offer a new perspective that can better inform the development of a project. In addition, when youth are meaningfully involved in research, there exists a mutually beneficial relationship between youth and adult researchers. Youth can come away from a project with a better understanding of the academic process, technical skills, and a greater sense of agency, while youth involvement conversely provides adult researchers with a greater sense of accountability and a more complete understanding of their findings from all perspectives. Now, clearly, youth-engaged research is a powerful tool to leverage and empower community voice. However, youth engagement must be carefully implemented in a way that allows for meaningful contribution without tokenizing the voices of young people. To do this, youth should be actively involved within the project and be given a platform that allows them to share their contributions unobstructed. And this authentic engagement can take many different forms throughout a project, but at its heart, it is vital that youth input is continuously valued. Now, different young people may have different strengths and goals. Thus, communication and clearly defined expectations and roles should be set well in advance. Now, it's also important to consider the dynamics of power between youth and adult researchers. Adult researchers may unintentionally exert their influence and opinion and shift group consensus to align with their views. And this jeopardizes the capacity for authentic youth engagement and creates an environment that limits youth autonomy. And to avoid this, adult researchers must be especially mindful about their position and power in relation to youth. So clearly, youth-engaged research doesn't just give young people a seat at the table, it gives them a voice that resonates far beyond it.
Thank you so much, Sasha. And I want to mention that Sasha, what he just shared is from his perspective and from his experience. And so, I don't know, it makes me smile to hear what he has to share about this process. So, when we're doing youth engaged research, right, as adults, it's really important for us to pause, self-reflect, and work on ourselves so that we can authentically and meaningfully show up and support young people. And so I know for me, you know, in full transparency, my original goals for this project were solely based on my own interests, career development, and career progression specifically. So I was doing this work to deepen my understanding of knowledge of factors and facilitators associated with risk and resilience to poor behavioral health outcomes among youth of color, right? So including influences of social and structural context. I wanted to advance my personal expertise on the methodological and practical skills of social and structural conditions and multi-level and spatial structural equation modeling. I wanted to develop skills in advanced qualitative research methodologies, right? So I was really thinking about myself in doing this work, but this was an approach that lacked authentic and meaningful engagement of young people. And as a researcher, my plan was to synthesize the ideas of young people through advisory boards or through focus groups into the data and really nothing more, right? So this was an approach in which young people would be consulted, but not necessarily be given feedback, and their perspectives wouldn't be as involved as they are now, right? So that was my starting place. So in my mind, I was being pragmatic and had this idea that I'm junior faculty and the tenure clock is ticking, and that I should just focus on doing secondary data analysis so that I can publish more. My funders want outcomes within 5 years, and I don't have time for true and authentic community engagement. And so this approach, you know, authentic community engagement takes time, and time didn't seem like something that I had or that I have, given the tenure clock ticking. And also, you know, in order to do this research, it's important to be able to provide things like childcare, food, transportation, and other supports to engage community. And my federal funding, you know, doesn't support this level of support for communities. So this is where the self-reflection came into play, so that I know that I want to be a person or a researcher who does work or research for social good, social justice, and health equity. And I wanted to pay it forward and support young people of color to become health and public health professionals in the same way that I was supported and mentored. And so it was important for me to learn how I can still honor what is required of me in my professional role, in my professional setting, while also honoring and centering the lived expertise of young people of color. They will be the ones who are impacted. And it's not okay for them to not have a voice in how my research will tell their story. And I share this story with you because many of us as adults have constraints and responsibilities that challenge our ability to truly center lived expertise. But if we truly want our work, data, and research to be for social good, we need to get creative. And that starts with positioning ourselves and our teams to be able to do this collaborative work. So for me, what this positioning looked like was starting with humility and acknowledging and understanding that young people of color are experts of the young people of color experience. And my role as an adult and as a researcher is to enrich the expertise of young people with the tools and skills that I can offer based on my training and based on my own personal lived expertise. So that they can use data and research to promote health equity and social justice for other young people of color such as themselves. Also, it was important for me to understand sort of the lens and the perspectives of young people, understand their context and understand their capabilities as best as I could. So I read a lot of literature on adolescent development, and I reached out to my mentor, Dr. Nancy Whitesell, who is a developmental psychology, to really understand what is happening as it relates to cognition and affect and behavior among young people. So I began to understand the structural changes in an adolescent's brain and what that means for cognitive capacity to support planning and decision-making that is required to do research. I also learned about the changes in their reward and emotion systems in relation to fearlessness and willingness to try new things, and their intensification of capacity for learning, which are all strengths for this research and for this work that we're doing. Many see sort of this rapid change within cognition and emotion or affect and behavior as sort of a challenge, but it's really an opportunity, right? So young people are curious, young people are learning and want to try new things. And so this is really a developmental stage where engaging young people, it's just, like prime, and it's just the perfect place in order to engage young people. So in addition to understanding where young people are as it relates to brain development, social identity is equally important. So at this stage, young people of color are understanding who they are and understanding how the world sees them as young people of color. And so it was important to create a space where they felt supported, seen, heard, and valued for who they are and not judged. And so it was really important to create this space where they can show up as their true and authentic selves. Another aspect of doing this work was making sure that I was creating a safe space and that I, wasn't causing any harm or re-traumatizing young people. So I don't have my own kids, I'm an auntie, but for me, it was really important to sort of reach out to folks to make sure that I'm doing this right and that I'm engaging young people correctly and that I'm not putting them at risk. And so I did a lot of training on boundaries and safety with Don Mosley, who is the executive director of Ralston House, which is an organization that works with law enforcement, human services, and the community to address child abuse and to promote child safety and healing. And then I also obtained resources from the University of Colorado Risk and Hazard Management. Last, I also wanted to begin to explore participatory research orientations. So not reinventing the wheel, but doing some literature review to figure out a way to most authentically and meaningfully engage young people. And so I started with Hart's ladder of children's participation. And so this ladder depicts various levels of youth engagement and youth power, with the lower rungs representing non-participation and the upper rungs depicting increased youth agency, control, and power. And the very top rung represents the highest level of participation, where young people initiate the research and share decisions with adults. For me, given that I already identified the problem and had a research strategy in place that is funded by NIH, full engagement or this child-led, or initiated perspective wasn't something that I was able to do. And me, given that I'm an overachiever, I was a little frustrated that I couldn't be at that level 8. But, through further exploration of literature and self-reflection, I came to an understanding that levels of participation are circumstantial, right? So they're based on funding, they're based on the time we have available, they're based on the resources, And in some instances, the timing and priorities of young people are also really important to consider. So for me, to ease my anxiety about not being at the top rung, I identified this version of Hart's ladder that has been reoriented to a cog and wheel diagram. And this illustrates that there really isn't a hierarchy on how to best engage young people. So various levels of participation are appropriate for different circumstances, and that any form of participation where young people are engaged and valued as experts and their voice is taken seriously is great. And it's okay that I'm not at the top of the ladder, and I'm doing the best that I can given my circumstances. So, the orientation of our research is adult initiated, and shared decisions with with the youth researchers are happening from now on, or from 2021 on. And so, we want to share with you now what this looks like in practice.
Yeah, so putting this principle of youth-centered research into real-world application, we have our project, the Youth Empowerment Lab. So the overarching goals for our project is to really understand the multi-level social and structural factors associated with substance misuse and adverse sexual health outcomes among urban youth of color, with our population of focus being those aged 13 to 19 in the Denver metro area. And these findings will be used to inform the development of a multi-level intervention that will create social and structural environments that by default promote resilience and that result in cumulative and enduring positive effects on the health of young people of color in the Denver metro area. Now, we adhere to the same basic framework as any other mixed method study, but with some additions to make it more intentional with centering the expertise of young people of color. So some of our additions include our team building and recruitment phase. Now, during recruitment, we were really intentional about recruiting youth of color who deeply care about enriching their communities and whose lived experiences allow them to fully understand the unique needs of them. Now, during this phase, we also engaged in some foundational training, which gave us youth the skills and necessary background information to put our ideas into practice. And we also carved out some time for team building to build trust among our team members. Now, because our project deals with such a sensitive subject matter, it was imperative that we were able to foster a comfortable and judgment-free environment. And as researchers, we've played a pivotal role in this project by leveraging our perspectives as youth to develop our multi-level conceptual model that incorporates historical, structural, social, interpersonal, and individual contexts for a holistic understanding of health. Now, of course, we're just at the start of our years-long project and are still crafting the ideological foundation that will be used to inform and validate our comprehensive intervention. Now, our next steps are to undertake a multi-phase optimization strategy trial, or MOST, to determine feasibility and refine the intervention we seek to design. But throughout all stages, youth engagement and voice will continue to be instrumental to the scope of the project. Now, during our first group meeting was virtual, and during this meeting, we outlined just a basic overview of our project along with team member introductions. And during our first in-person meeting, we established agreed upon team norms and rules, along with clearly defining the role that us youth researchers will play in the project. And we also dedicated some time to exploring and getting comfortable around our CU Anschutz campus. Now, our second research retreat was an overview of what is research and what it looks like in practice, along with an introduction to the scientific method and how research can be used as a tool to reduce inequity. Now, our third research retreat was planned to be some more foundational background information on public health, but as a result of the East High School shooting, we instead dedicated this retreat to a time of healing and reflection. And this kind of ties back to our holistic approach, where we support the needs of the team above the needs of the project. Now, our project really kicked into high gear with our week-long research retreat, which took place from June 12th to 16th. And the purpose of this retreat was chiefly to begin identifying the factors we believe to be associated with our health outcomes. But again, we also carved out some time for team building activities, which, as previously mentioned, are vital to creating a comfortable and engaging environment while also lessening the pressure that a rigorous academic setting can impose. Now, during this retreat, we hosted numerous guest speakers whose lectures provided us with some requisite background information about topics relating to our health outcomes, which really helped consider them in a much broader context. So we had many different professionals from a variety of disciplines share their expertise with us, including an official from the Colorado Department of Public Health and Environment, who came to talk to us about the Healthy Kids Colorado survey and its applications for our quantitative phase. We also got an introduction to experimental design, including basic quantitative and quantitative data analysis, along with an introduction into adolescent psychology and the unique considerations that adolescent development entail. And the purpose of all these lectures was really to give us the skills needed to translate our lived expertise into actionable data. Now, after this retreat, we continued to meet weekly throughout the summer, and we now consistently meet throughout our current school year, typically 2 to 3 times per month in person with weekly virtual meetings. Now, during the rest of the summer, we continued to develop our comprehensive conceptual model and used the nominal group technique to synthesize individual views into one cohesive framework. And we also continued our process of skill building in order to become more authentic youth researchers. And finally, we engaged in individual journaling sessions, which helped us to more clearly establish our goals and reflect on our methods. Now, within our project, we adopt a holistic reciprocal relationship with our youth researchers, meaning for that what they give to the project, we give back to them in the form of college and career support. So in addition to being paid for our work on the project, since the majority of our youth research team are high school seniors, Dr. Tuitt has ensured that we've been given the resources needed to guide us through the college application process. So some of the ways we've been helped to prepare for success is through touring colleges around Colorado and meeting with the diversity, equity, and inclusion officials at these schools to gauge their campus's demographics and efforts to support students of color. Now, we've also met with a college essay counselor who has helped us really fine-tune our writing and composition skills to craft college essays that reflect us and our own unique experiences. Now, all of our work thus far has culminated in our conceptual model, which is a compilation of all of our hypothesized factor associations into one cohesive framework. So the development of this was really informed by our trainings and skills we built from our research retreat, and it was guided by the principles of the Bar-High framework and socio-ecological model, which are 2 frameworks that present bases for health inequities with considerations of factors from all potential levels. Now, incorporating these principles, our conceptual model is multi-level and considers both upstream and downstream factors in public health to achieve a holistic understanding of health inequities. And it was created using a collaborative and iterative workflow, which roughly followed the principles of the nominal group technique, although on a much longer timescale. And it will be used as the basis for developing and validating our future interventions.
So from there, we needed to figure out from how to translate the conceptual model into to be able to analyze it quantitatively. So we had over 60 multi-level factors, and we needed to figure out how to put that into a more parsimonious model. So a model with fewer parameters so that it can actually be estimated with secondary data, the data that we have available, and also more parsimonious so that we can interpret the findings, right? So we can understand like what the findings are telling us. So the data that we are using for this study are the Healthy Kids Colorado survey data, the American Community Survey data, and data from the Colorado Department of Public Health. So we are using secondary data and not collecting primary quantitative data because we don't have the capacity or the time or resources to create our own measures, right? So as many of you know, creating a scale or measures requires cognitive interviews, piloting with a developmental sample, and then administering the survey in itself to a large enough sample. So something that I want to note is that our conceptual model focuses on protective factors and is oriented in the strengths of communities of color. However, the secondary data that are available are risk and deficit focused. So, you know, we are going to collect some qualitative data to get a counter narrative to the deficits, right? So that it'll be more focused on the strengths and resistance and resilience factors. So we use our youth participatory secondary data analysis approach that started with an overview of secondary data that was provided by Dora Libet, who is a DRPH epidemiology student and is a graduate assistant in Dr. Kathy James's secondary analysis course. We also met with Dr. Ashley Brooks Russell, who is the survey director of the Healthy Kids Colorado survey, and she came to speak to our students about the overall survey, the types of questions asked, and the sampling process. So after we met with Dora and Ashley, we did an activity where the students took the concepts from their conceptual model, right? And we printed them out, right? So things like positive self-esteem and mental well-being and positive childhood experiences. And then all the students literally got a copy of the Healthy Kids Colorado survey, and they just started cutting out the questions that were relevant to the constructs that they identified. So they were the ones who were identifying and selecting the measures that we were going to include in our model. And in this process, because of the limitations of the secondary data, we were able to trim the model and make the model more parsimonious because the data didn't capture many of the constructs that we identified, which is fine because with our qualitative interviews, we'll be able to do a convergent mixed methods approach where we integrate all of the both the quantitative and the qualitative data together. So with the Colorado Department of Education data and the American Community Survey data, youth researchers learned about proxies, right? So the CDE data and the ACS data didn't have exact measures that were in alignment with the constructs that were identified in our conceptual model. And so we identified proxies, right? So things like school social environment and reviewing the literature, truancy and absenteeism and dropout rates were a reflection of what the school social climate was like. And then as it relates to CDE, when we were trying to think about how to best measure school resources, the youth researchers actually created a crude measure by doing searches on the CDE website and then also on the websites of the schools to see what resources they had to support, opportunities for young people of color to thrive. So not only did they identify measures to be included in the model, but they also helped they actually led this activity and they created directed acyclic graphs, so DAGs, to create a conceptual representation of how the various constructs and the factors of the conceptual model are associated. And then we broke it down a little bit more and looked at created path models to specify the relationships among the specific variables that they identified within the HKCS, CDE, and ACS data. So right now, I'm currently in the process of analyzing the specified models, and I plan to use multi-group, multi-level structural equation modeling with geographic data to analyze these relationships. So this upcoming Saturday, so in 2 days, we're also moving into the qualitative phase, where the youth researchers are going to identify the factors that we weren't able to measure with the secondary data, and we're going to create our qualitative approach. And the qualitative approach that we agreed upon this upcoming Tuesday, or this past Tuesday, right, during our weekly meeting, was scenario-based interviewing. Because we don't have the time to train the young people we are going to be interviewing on the socio-ecological model, the Bar High framework, and all the other training that the youth researchers have had. So we're going to create scenarios and stories of our conceptual model depicting a young person's of color experience of the protective factors that are included in the model and how they relate to substance misuse and sexual risk-taking. And then not this weekend, but the following weekend, we're going to come up with prompts to find out more about the interviewee's understanding of the experiences and understanding of the conceptual model and about the relatedness of the conceptual model to the actual lived experiences of themselves and of their peers and of their family members.
Yeah, so once both our quantitative and qualitative data is collected and analyzed, we are going to integrate both sets of findings to get one comprehensive story of how multi-level contexts influence the health behaviors of young people of color in the Denver metro area. Now, as for lessons learned, this whole amazing process has given me so many insights that it would be impossible to list them all. But some of my main lessons learned include that communication is key. So going into this project as a high school student seemed to be pretty daunting, but having really clearly defined roles and expectations helped to lessen that intimidation factor and allow me to understand the part that I will play in this process. I've also learned, of course, that youth are experts of their own experience, and we don't necessarily need advanced technical training or degrees to be able to share our insight into the world that we live in. And that honest and true reflection of our own experience has played a monumental role in shaping our project. I've also learned that public health is a diverse and multidisciplinary field, so it's important to listen to and value others' perspectives. And maintaining an open mind like this can help to expand your worldview and understand viewpoints that differ from your own. And finally, I've learned that health outcomes are a product of an interacting web of factors, and contrary to what many may immediately believe, they're not always due to simply making poor choices, but instead can be a result of the often invisible influences of the social and institutional environments that young people live in.
And for me, my lessons learned were to go slow to go fast. One, as it relates to trust and relationship building. So the first year of this study, we really had quarterly research retreats and just shared a meal with each other, like lunch, and did activities like scavenger hunts and eliches and different things to really develop the relationship with young people. And then also, given my position as an assistant professor, my intentions originally were to just do a bunch of secondary data so that I could publish more. But doing secondary data analysis this way is just better science and richer science. And so even though it's taken some time for us to finally get to the place where we are finally doing some quantitative and qualitative modeling and some data integration, I think the story that the data are going to tell are going to be richer and more relevant stories. And then, so this sort of aligns with getting creative within your own lane. Yes, the requirements of tenure, the requirements of your funding agency or of your organization that you work in. You need to get creative and really think about how you can be really authentic and centering the lived experiences of young people despite these constraints. And then also young people are brilliant and understand more than we as adults assume. You all hear Sasha and like Sasha's experience, like Sasha and all of the other researchers that are engaged in this process just surprise me every single time that we meet, just the level of expertise that they have of their own lived experiences and how quickly sort of the content, the research content that they pick up and just, we'll start with me doing a 30-minute session. And then for the rest of the session, they're leading it and doing the activities themselves. And I'm just sitting there observing and munching on snacks or something. But, just the abilities of young people are endless. And that's something that I learned. And then also this process is non-linear and iterative, right? So I think everything that we do in public health, we have sort of this linear plan of doing our project, but working in the real world, it's non-linear and you have to sort of try things over and over again. And then also in doing this work, supporting young people beyond the interests of the project, right? So as an adult engaging with young people, yes, I do want to move my research forward, but first it's treating my team as the whole person, right? So focusing on what supports and what capacities they need to thrive in their everyday lives so that they can show up and really be involved and engaged in the work that we're doing. So thank you all so much for your time. That is our presentation. And now we have a few minutes for some questions.
my goodness.
follow, if you would be great if you could follow us on Instagram, where the youth researchers are trying to get their numbers up.
Absolutely. Please check the links out. That was absolutely invigorating. I think that is precisely what pretty much everybody here is signed up to hear. Thank you so much, both of you, for delivering such a powerful and impactful message. And we wish you all the best with your research. I have a ton of questions, and I'm so happy to get into them. But before we do, I do want to highlight one that came in the chat, and it's to technically it's to both of you, but I think Mr. Wyden, this one came towards you. The request was to have your let me pull this up precisely. The request was, could you share your statement on youth engagement in a written form? There are some of the audience members that would love to share your message with appropriate credit, of course. They would love to amplify and pass along what they're learning from you. So if there's a way to have what you've just discussed with us in some sort of written form, we would love to have that. So please, your thoughts.
Yeah, definitely. I'd be able to share that. I have a Google Doc with like my talking points, so I'd be able to send a link.
That's wonderful. And within Cultural Data, we'll find a way to make sure that reaches people. So thank you so very much. I can't say enough about it, but I will keep going if I don't stop myself. So I'm going to open the floor up to others to start asking their questions, and want to make sure they have enough time for that. So right now, Q&A is open. Please come off mute, put your questions in the chat. We will help monitor. Bring your questions to our keynote speakers, and we look forward to hearing more from you. At 10:10, we will wrap up our Q&A and we'll get ready for our next steps. So the floor is open. Please jump in, stay engaged.
I think there are questions in the chat that we can start with. I see the first one coming from Carol. I'm not sure if the speakers can see it, but could you comment on how others in the research world reacted to this process/model for youth co-researchers? And this is to both Nicole and Sasha.
Sasha, do you want to go first?
Sure. So I feel like some people, like initially, they might be kind of apprehensive towards this idea of youth engaged research because they might not be, I guess, aware of the contributions that youth are able to make to a project. But I think once people actually saw how this like youth-led model has proven to be effective and how it's proven to, deliver results, their mindset is kind of changed.
I think it's interesting. So the feedback that we've gotten from other scholars is that this is innovative and that this is a really great approach to doing research, and it addresses sort of health equity by centering the voice of expertise. But to me, in my community, I feel like I'm an auntie, right? Like the work that I'm doing is sort of what is expected of me, right, as a community person. So when I hear that it's innovative, I'm thinking to myself, this is what we do, right? This is what we do in our communities of color. And so, I mean, but I guess I'm glad that people see it as innovative, because then that means that I have maybe some job security. But, yeah, like we've gotten a lot of really great feedback and a lot of requests to publish. Even from my mentor who asked this question, Carol Kaufman, she's the primary mentor on this project, to share this work because it is seen as innovative in the research world.
Wonderful. Thank you so much. It looks like there are plenty that are coming in from the chat. Let me just do a quick check-in in the room to see if anybody is willing to come off mute and start their questions. You are more than welcome. And after a few seconds of pure silence, we'll go back to some of them in the chat, and I still have plenty.
I have a question, Dennis.
Oh, perfect. Lala, please.
Hi, Dr. Tuitt. It's good to see you.
Hi.
I guess my question is, I'm a collaborative biostatistician, so in some of my projects, not all of them, I get brought in at the end once data has been collected. There are set hypotheses that I'm being asked to test. And so when thinking about this in the context of my job, I was wondering if you have any potential suggestions about ways that I could train my team or improve the way my workflow is, so that I'm not just, analyzing hypotheses that might have been set by a research team that does not reflect the population we're studying.
Yeah, I mean, I think that there are a lot of or youth participatory orientations that research teams could do. Like, so I know for me, like I already had sort of the hypothesis in place, and then I needed to figure out, if there were any modifications that needed to be made. But I think that, oftentimes if there are hypotheses that are already pulled together, you know, reaching out to existing youth advisory committees, or even, colleagues within our institute who have done this work to figure out ways to be more intentional in engaging young people. Something that I'd like to throw out is that my youth researchers and I had a conversation about, if we would, given, the lived expertise and now their training and research methods, how we can support other projects so that we are promoting the health of young people. And so I think that collaboration is another way that you can sort of promote the voice of young people, but always remembering that whatever way you're engaging young people, whether it's through a board, that you're really valuing and listening to their perspectives, and that you're going back to them and sharing with them how the work or how the input and how their voice and perspective was integrated throughout. Yeah. Sasha, do you have anything that you want to add?
No, I think you pretty much summed it up.
Wonderful. Anyone else willing to come off mute? Please, you're welcome to. All right, but we will keep things moving. I have a couple more in the chat that I'd like to elevate before I get into my own and be completely selfish.
I think there's a few questions in
there?
the chat. Like Melody said, I'm sorry if you already addressed this, but Sasha, how did you become involved and connected with this?
Yeah, so with me, mostly youth researchers. So about two summers ago, I believe, Blessing, a member of our team, she created a poster that she gave to schools around the Denver public school system. So that's how most youth researchers got connected. For me, I actually emailed a member of the Center for American Indian and Alaska Native Health, just looking to see if they had any opportunities. I had heard about this organization, and I really just want to be able to kind of leverage my perspective as a Native youth to be able to do some good for the community. And they connected me with Dr. Tuitt's project, and I just thought it was a really amazing opportunity to be able to be just a voice for Native youth and to better the health outcomes for urban youth of color.
I think
Perfect. Please.
Oh, thanks. Sorry, I just wanted to elevate another question that came way earlier in the chat by Lillian. She was curious, or they were curious, if youth were engaged to determine this as the optimal return for their expertise and contributions, and what was deemed meaningful for all the youth engaged.
Yeah, so going into it, all researchers knew that they were going to be paid for this work, but we did have some discussions about like what they would like to see in return, and actually all of our youth researchers, we are college bound. So we all thought that, touring universities, seeing where we might want to end up, and also getting our college essay counselor, that would be a really, valuable experience. So there was a lot of direct communication between us and Dr. Tewitt about, what we wanted and what she wanted from us.
I mean, and even beyond the school related things, like what do they want to do for fun, right? So sometimes with this work, it can be overstimulating. So, they decided that they wanted to go to a Rockies game that got rained out, and then Elitches and Meow Wolf, and we did scavenger hunts, and we did Juneteenth events, and more recently we did an escape room. So, help supporting them and what their interests are beyond, like, to have fun was also something that was really important.
Thank you. And I also wanted to bring to the fore another question. Thank you for those responses. Can you share resources on scenario-based interviewing?
Yes, Erin, I can send you, or I can post it, but yeah, I can definitely send you resources on scenario-based interviewing. I haven't really seen a lot published in literature here in the US, but in the UK, it seems to be an approach that they use with young people frequently.
Thanks so much. Other questions that anyone would like to ask live?
I have a question. Hi, good morning. Thank you for the presentation. It was super interesting. I think I'm curious in how did you all feel that you had to manage the expectations of the youth that you worked with as far as what the outcome would be? Do you see what I'm saying? Like when you're that intensely engaged with community and you're still working up against systems that may not be necessarily receptive to kind of a more innovative approach. And maybe you're not far enough down the road yet. Maybe this is a question that would be better answered in a few years. But what do you think the expectations are of the youth who are involved in this project? And I don't know how. I guess, can you speak to that? Is that clear?
It's interesting that you say that. I think a lot of the youth researchers didn't really know what to expect. And to be honest, I'm learning as we're going of how to be authentic and meaningful in terms of meeting their expectations, as it relates to the youth. But as it relates to the community, like the level of support that we've received and the expectation, like I wasn't really sure, because in academic settings, there's a right way to do rigorous science, and the level of support that we've received from scholars has been amazing. I mean, we're still doing rigorous science. I mean, we're still applying sort of the scientifically rigorous approaches to qualitative analysis and quantitative analysis and so on and so forth. But yeah, I mean, in terms of expectations, I feel like this is sort of a new area for me and for the youth researchers. And so I think as we're navigating this process, to me, we exceed expectations in a sense, even though we didn't really have specific expectations. I don't know. Sasha, is there anything you want to add to that?
Yeah, I suppose like going into this project, I didn't really, as you said, know what to expect, but I was pleasantly surprised by like the level of autonomy we were given and how it wasn't just we were operating like in an advisory capacity, but we're the ones actually like leading the data that's going to be tested. Like we're the ones who are actually like creating our hypothesized associations between factors that are being tested. So I guess I was surprised at the like level and depth of youth engagement.
Thank you.
Can I ask a question if we have time? So thank you again, Dr. Tewitt and Sasha. Your insights and what you're able to share is so invaluable here. I had a question just around in the future, if, or even now, do you see your work kind of, or do you see a role, a potential role being, kind of entering community spaces that are trying to do similar work with youth involved in youth-led projects and kind of serving as a consultant in a way? So I'm with Public Health for Public Safety as well. I'm wearing multiple hats, and we've been recently awarded a grant through the city to lead a youth-led project. And we're, wanting to engage all the currently existing wonderfully, just they do great work, youth-based or youth-led group like say Rise Up Academy, Fully Liberated Youth, Groundwork Denver. I'm just kind of a shameless plug. Project Voice, Grasp, Struggle of Love, Heart and Hand Center, Circle Core, I for Prevention. So I'm sure maybe you've heard of some of these youth groups. But we're wanting to do exactly what you're doing, except we're kind of outside the space of academia. We're all just in community-based. And so do you see kind of that intersection and kind of entering these spaces if, requested? Because I would love, love, love to have your voice or your expertise kind of shed some light on the work that we do moving forward.
Yeah, I mean, we're already getting requests and we're already collaborating with folks. And then also on the advisory board, we have some folks from like YASPA and Educational Access Group who are also doing youth engaged research. But yeah, who, when folks reach out and if we can provide support, we are definitely open to that. And that's a conversation that we had about sort of expanding the youth to youth empowerment lab to not just focus on our immediate research, but figure out ways that we can support other organizations that are doing youth-led and youth-centered work.
Nice. I will be following up.
Oh, absolutely. You definitely should follow up.
All right, everyone, as painful as this is, we're going to have to wrap up the questions here. However, they left their contact information, and I'd like to always say they wouldn't leave it if they didn't want you to use it. So please contact them, find out more, ask more questions. It can only enrich the work that we're all doing. So thank you so very much to our keynote speakers. And thank you for your work in promoting equity for our youth. Thank you also to all of our attendees. And I hope, like me, you were really energized. This was probably the best start you could have asked for. I hope you're energized and ready to take on the rest of our day. There are a few items that I want you to be aware of as we're opening up our session. So just a little bit more. The slides that we just went through, the slides and any other additional handouts the speakers have provided, they are available on Sched. That's not necessarily including the most recent request, but that is something that I believe we can work out. After the conference wraps up tomorrow, each of you will receive a conference evaluation form via email. So pretty please, cherry on top, please fill that out, even if you only attend a portion of the conference. So keep in mind, like the changes to this year's conference were made with last year's responses in mind. And this is your opportunity to be heard and to help us improve both the content and your own experiences. And for a little more incentive, there will be a raffle entry for each person who completes the survey within about 2 weeks, where you can win one of 2 $50 gift cards. All right, that's enough for me. All right, we have just a few moments. We're going to get ready for our sessions, so let's get ready. Starting with concurrent session A. That will begin at 10:30. So between now and then, take a bio break, relax, let everything you've just heard get absorbed. Thank you so much, everyone, for your presence here. I cannot wait to hear your thoughts. And once again, welcome to Culture Data 2024.